Hello, everyone. I'm Dr. Marty Ross. This is another Conversations with Marty Ross MD tonight. It's a webinar where we're going to talk about Lyme disease. As you all know, especially those of you that are returning, this is a webinar that gets created by your questions. So I'm very interested in seeing what you have in store for me tonight. In terms of how you participate, there's a couple ways. One, you can write a question, especially if this is your first time here, go bold and write a question. And the way you do that is there's a chat box over on, I think it's the bottom right-hand side of your screen that you can write your question. Now, that chat box is confusing. So there's a to chat icon and there's a question mark icon. Write it using the to chat icon, okay? So it looks like two chat screens side by side. Click on that before you write your question because that's where I tend to focus on. I tend not to go to the one that has the question marks on it, okay? So just be aware of that. I am seeing many familiar faces here, or names at least. I can't see your faces, but I do see a number of new people tonight. So I'm glad to see new people here as well too, and I'm glad to see those of you that keep coming back. I hope you're getting some benefit out of this as well too. As usual, I am creating a recording of tonight's webinar, and if it does go as planned, and 99.99% of the time it does, that should work, and I'll do a short edit on it tonight, and then I will create a summary of that and get it out to you along with a link to the webinar tomorrow morning. When you get that link to the webinar tomorrow morning, you'll also be able to sign up for our next webinar, which is actually in 2 weeks this time. I actually have some friends coming into Austin from out of town next week, and I didn't want to disturb my visit with them by doing a webinar with you all, although you're very, very near and dear to my heart, but I did want to spend some time with some friends. So we'll be back here again with you in a couple weeks. The other thing, let's see. Oh, yeah, so you'll be able to sign up for that again tomorrow too. And then when you get that email from me tomorrow morning, share it with people. Share it with anyone that you would think would benefit either from the content of what we talked about tonight or may benefit from participating in our webinars in the future. Okay? All right. So without any further ado, I think we'll go ahead and get started here. There's either a number of questions. Oh, one last thing. So this format, as many of you know, works better for shorter questions, not the long life history kind of questions. Okay, so keep that in mind as well too. All right, so let's go ahead and get started here. Hello, Matthew. Let's see. Hi, Dr. Ross. I have a question. Is it normal for Babesia IgM to stay positive for a year and never go to a positive IgG? Does the positive IgM mean Babesia is positive, or could it be a false positive? That's a good question. So I'm going to give you a longer answer to answer that. Okay, so just bear with me. All right. So many of you may know, but if you don't know, basically the way that antibodies work, there's two major families. When people get infected, they get activated. One of the families is called IgM antibodies. There's a second family called IgGs. IgMs are what get activated when you are acutely sick, and then they are supposed to go away, and they get replaced by what are called IgG antibodies. When you get IgG antibodies, they serve as the memory of the immune system. So they will remain to some degree even when your infection is gone, or they will remain even if the infection is not gone. Okay, so the best we can say when you get a positive IgG test is that smudge up on my glasses there. The best we can say when you get a positive IgG test is that you've had the infection. And the way that we say you probably still have the infection is we couple that based on what your current symptoms tell us as well too. Okay, so I know your question is about Babesia, but I need to get to Babesia. I got to go through Borrelia first. Okay, so in Borrelia, we know that around 50% of people that have chronic Borrelia, chronic Lyme, still keep making IgM antibodies. And how we know that is about maybe over 15 years ago now, the National Institutes of Health developed some studies looking at whether long-term antibiotics would help people if they had failed initial short course antibiotics. And to get into that study, people had to do testing, and they chose people in the testing, then they had to test positive. But what wound up happening in the enrollment period is people that had, been treated a long time ago and then got retested again, about 50% of them still had positive IgMs, all right? So we don't fully know why you keep making positive IgMs, but there's a number of theories, but one of them is that within the immune system, at the place where I think it's called germinal centers, where the immune system sees these infections, there's supposed to be a progression in the germinal centers from producing IgM to IgG. And for some reason, Lyme may scar those germinal centers or injure those germinal centers so that that natural progression for Lyme never takes place. Okay. All right. All right. So we know in Lyme, 50% of the time, IgMs don't go away. So in Lyme, an IgM being positive does not mean it's necessarily an acute infection. Okay. All right. More recently, Dr. Burrascano, and helping to do some work with IGeneX, reported that in some IGeneX has a method of checking for Bartonella. That's a newer method over the last year called an immunoblot method. And in introducing this new method, they were able to just tell that some people with chronic Bartonella were also still making IgM, so that they weren't able to quantify what percentage. Okay, so Bartonella, it seems like it may happen too. No one has ever done any studies to say if it happens in Babesia, meaning if you fail to progress from IgM to IgGs in Babesia. I have had some instances in my practice, though, where I think that has taken place. And I think what happens is if you happen to have Borrelia at the same time, the same process that may scar or injure the germinal center so they don't progress to making IgG for Borrelia, perhaps they're injured in a way that they don't progress anymore to making IgGs for tick-borne infections and maybe everything, okay? All right, I'm just postulating here, okay? So although it's not common, I would say at this point, if you're still making IgMs, it does not mean acute infection. It's either that your system is not able to progress to making IgGs, or there still is an off chance it could be a false positive test as well too, okay? All right, good luck to you, Matthew. Thanks for letting me give you that long-winded explanation there. Hello, MM. Let's see. Hi, Marty. I am fighting chronic reactivated Epstein-Barr post-COVID. My tonsil is still swollen with white pus pockets. What program of supplements would you recommend being the most effective for an immune system that is burdened by Lyme and co-infections and SIBO and yeast and having a very difficult time clearing Epstein-Barr virus after COVID? I'm ready to move on from this sore throat. Thank you. All right. So I'm not clear that your sore throat is coming from Epstein-Barr virus. All right. So if you've got white stuff on your tonsils, that usually means more bacterial rather than viral infection. And so I would hope that you have seen your doctor, so they've actually done swabbing to see, is this bacteria? Okay, I would hope, I assume you probably have, but I just want to point that out, okay? The other thing that can happen with your tonsils is your tonsils sometimes have little cavities in them called crypts, and those crypts can get infected as well too. So it may not be Epstein-Barr, it may be a bacterial infection, okay? In terms of if it is Epstein-Barr, unfortunately, we don't have decent Epstein-Barr oral antibiotics or oral antivirals, prescription antivirals you can take. I know some of my colleagues will sometimes use antivirals that we use against the herpes virus, like valcyclovir, acyclovir, but the truth is there is no science showing that they work against Epstein-Barr, all right? So if this in fact is Epstein-Barr, then what you need to do is get on some kind of an antiviral regimen that would help start reducing the germ load for Epstein-Barr, all right? And so what I like to use to do that is olive leaf extract. And I usually like to have people start at 500 milligrams 3 times a day. And as they can, based on Herxheimer reactions, build up to 1,500 milligrams 3 times a day. At the same time, you want to do some things to boost your antiviral part of the immune system. And what is useful to do that is reishi mushrooms. Mushrooms can be antiviral and especially or turn on the antiviral part of the immune system. And it seems of the various viruses, reishi tends to have the greater chance of turning on the antiviral part of the immune system. And so what I usually will have people do is take reishi at 400 milligrams 3 times a day as well too. And then if you can still get your hands on it, what I found effective was to do a transfer factor mix by a company named Research Nutritionals. Their product was called Transfer Factor Plasmic. Unfortunately, they are stopping manufacturing of it. I'm not even sure if I still have supply of it or not. But transfer factors are substances made by your immune cells that target the immune system to go after whatever that transfer factor is made for. Okay, so for instance, we make cold virus transfer factors in our bodies. We make transfer factors against Borrelia, and we make transfer factors against Epstein-Barr. And so I'm not clear if that product is still available or not, but if it is, you would do a 1 pill twice a day on that. Okay, all right. So that's kind of what I would look at. I will show you an article that I've written about how you treat chronic virus infections, which basically pertains to this. And let me just do that here real quick. All right, so this is my website, Treat Lyme by Marty Ross MD. On here, I have an online Lyme guide. Take a look in my infection treatment plan section here and scroll down. There's an article I have on treating chronic viruses. And in general, I don't believe in treating chronic viruses. I don't think for most people that we need to go after them. But I will tell you, it is possible with COVID that you have reactivated Epstein-Barr. All right. So just in here, you can read through this, but I kind of talk about the pros and cons of testing, the pros and cons of treating, and what we do to treat. And in this section here is my information on olive leaf extract and on reishi gano and that transfer factor plasmic that I was telling you about. Okay. All right. Good luck to you. Hello, Trish. Hi, Dr. Ross. Mold question. A lab found every mold they tested to be present in me. Are these tests reliable? This is a blood test called Mycolab. I have Lyme, Babesia, and Bart. I've decided to stop those treatments and work on mold. Would you do the same? Stop the tick infection treatments. And 3, is this crazy protocol? Itraconazole, 1 cap twice a day, well called 250 or 625 milligram, take 2 tabs twice a day. Buzzing vibrations in feet. It's been months. What is this, Dr. Ross? By the way, I'm joining your Lyme United after this webinar. Great. I'd be glad to have you join us. So thank you. I'd answer your question either way, though. So anyhow, so there is a newer lab on the block. So traditionally, when we're looking to see if you have mold toxins in you, over the years, most of us that treat these disorders rely on a couple labs. One is called Mosaic Labs. Another one is called Real Time. And both of these labs are measuring through different methods. They measure whether you actually have the toxins in you, so they can actually see the toxins. Okay. So when you do their urine test, you're getting a report that says we were able to detect this kind of quantity of trichosethine in you, which is black mold toxin, for instance. Okay. All right. More recently, Vibrant Labs is also doing urine tests. I'm just not sure of the validity of their tests. I'm not sure about the validity of any of their testing, actually, for different reasons. Okay. But I do trust the validity of Real Time, and I do trust the validity of Mosaic. Okay. And then more recently, there is this lab called Mycolab that has been testing, and they're doing an antibody test. And these antibodies are measuring whether you're making antibodies against the mold toxins. Okay. And so it's an immune reaction against the mold toxins. And they are measuring both IgM and IgG. Now, if IgMs are positive, that probably means a recent exposure, and I think that's accurate. If your IgGs are positive, the problem remains. It would suggest you have had mold exposures and that they're in your system, okay? But in terms of being able to rely on those to accurately detect if your treatment is done, by going back and remeasuring them again, as I said earlier, IgGs can stay present for a very long time. I wouldn't rely on a mycolab to help me decide if I'm done with treating. You could use them as a way of diagnosing if you have mold in you. If you're making the antibodies and you've never done anything to pull mold toxins out of you, then I think it makes sense that that would be a positive test. Okay. All right. Now, in my practice, if I was treating somebody for tick-borne infections and I also discovered that coincidentally with that they had mold toxicity, I usually would add my mold toxicity treatment on top of taking the tick-borne infections treatment, okay? The only time I wouldn't do that is if I want, or a couple of situations I might not do that. One is if I've got a person that is just has horrible times with herxes and is very sensitive to medications, I might pull back on my tick-borne infection treatment so I can introduce the mold toxin treatment. Okay. All right. I might do that. All right. But the major time I might do it is when I discover they have positive mold toxins. I would usually spend time really talking to the person again, trying to understand what happened when they first got sick. And for some people, even though they came in to see me, they had all the symptoms that looked like Lyme. They had positive Lyme testing that suggested they had Lyme as well, or other tick-borne infections. And I made my decision to start treating. The problem with mold toxicity is sometimes it looks just like Lyme. And sometimes, even when people have positive Lyme testing, positive Bartonella testing, positive Babesia testing, and even though they have positive testing, that doesn't mean it's their problem, right? And the reason is, when you have tick-borne infections, your major symptoms come from your immune system overproducing chemicals called cytokines. Well, when you have mold toxicity, the major reason you feel sick is your immune system is producing too many cytokines, okay? So cytokines are made by white blood cells. They're good and bad. On the good side, they cause more white blood cells to be made. They help draw those white blood cells to where the infection is, and they help those white blood cells work better. But in tick-borne infections and or sometimes in tick-borne infections, in mold toxicity, in too many yeast living in your intestines, your immune system doesn't do a good job and it tries harder and harder and it makes too many cytokines. Too many cytokines give you brain fog, make you hurt all over, give you severe fatigue. You get what I'm describing here, okay? So excess cytokine symptoms are Lyme symptoms, are Bartonella symptoms, are a majority of your mold toxicity symptoms, okay? So when I get these tests that look really bad, or like a person has a lot of mold toxins in them, I usually go back and I say, hey, I just want to review what happened when you first got sick. When you first got sick, did you have an obvious mold exposure at that same time? And obvious means, yeah, I had all this black mold that was growing on the wall of this new house that I just moved into. And within 3 weeks after I moved in there, I got sick, right? In that situation, it probably is mold toxicity. And so, yeah, in that situation, I might stop doing the tick-borne infection treatment. On the other hand, if this is just another layer to your illness, and unfortunately, people with chronic Lyme disease often have many layers, I would not stop your tick-borne infection treatment. I'd still keep doing that, and you can layer on the mold toxicity treatment on top of that, okay? All right. And then, in terms of your protocol, I don't entirely agree with this, but let me tell you what they're doing. So the well call is what's known as a mold toxin binder, and they're giving it to you to start pulling those mold toxins out. So what happens with mold toxicity is there's 25% of the people in the world that have this problem, whether they have Lyme or don't have Lyme. And what the problem is, we're genetically predisposed to not breaking down our mold toxins, right? So in 75% of people, if you breathe in mold toxins from the world around you, they get into your lungs, they get into the bloodstream, your immune system will see those mold toxins and break them down. But in 25% of people, that doesn't happen. And what happens then is these mold toxins go to the liver, and the liver is supposed to be able to remove them because the liver is supposed to remove fat-based toxins from our body. But unfortunately, the liver is not programmed to handle mold toxins. So they go to the liver, they come out of the liver still as a fat-based toxin, and then they get moved through the bile system and your gallbladder out into the intestines. And then in the intestines, because they're still fat-based, they get reabsorbed back into the bloodstream. So you get this endless loop, okay? What Welchol does is it is a prescription binder that can grab hold of those toxins out in your intestines so they don't get removed. So you can start pulling those toxins out of you, okay? That I agree with, okay? Now, here's the part I don't necessarily agree with. So when you have mold toxins in you, the greatest chance you got them was from breathing them in the environment, okay? Occasionally, when you're in moldy environments, in addition to having breathed in those mold toxins, some people breathe in mold spores, and those mold spores will start living inside your nose passages and sometimes down inside your intestines. And inside you, they set up shop and they start producing toxins, all right? So there is a situation where you sometimes need to start killing the mold spores in you so that you're not producing your own toxins as well too. However, what I have found in my practice is that around 80% of the people I treated for mold toxicity, I never had to put them on anything to kill for mold spores. That often just getting them on a good binder would be enough to pull those mold toxins out, okay? Some of my colleagues, on the other hand, take the viewpoint that that's true, but there's enough of a risk you could have mold colonization in you causing part of the problem. I should just start killing the mold spores right away. And your provider seems to be one of those. That's what the itraconazole is for. Okay? All right. Anyhow, I'd be glad if you join my Lyme United group, and be glad to have more discussions with you about this there. And we've got a lot of very mold knowledgeable people inside the group that will be able to add. You can talk to them. You can talk to me. Basically, you write to them and you write to me. But then once daily, I respond to questions that come to me. All right. And then within my Lyme United paid membership group, weekly, I have an event called Ask Marty Ross MD Live, which we perform in a Zoom room so that I can see you, you can see me, and I actually get to ask you further questions. So there's a lot of great content on that site and a lot of good support as well, too. All right. Good luck to you, Trish. So listen, everyone, I'm inviting anyone that wants to join Lyme United, join it. If you think you're getting help within this setting, within my free webinars, you'll get my Lyme United membership group is like this group on steroids. Okay. Steroids may not be a good description if you have Lyme, but you get the point. All right. Let me just do a quick screen share here. So if you want to read more or want to join the group, I want to show you how to do that. All right, so this is my Treat Lyme by Marty Ross MD site again. My Lyme United, if you want to learn about it and even watch a small video where I walk you through what we're doing there, you can do that here. I give you a good description of why you want to do it. We even have got some good reviews from people, etc. So take a look here and see if this is right for you. I'm always looking for members here. And I will tell you, we got a very active group, so and a very helpful group for people as well, too. All right. Good luck to you, Trish. Hello, Kelly. Let's see. Question 1. I now have positive IgG IgG result for Babesia, and I feel like I have symptoms that align with chronic Babesia. If that's a thing, even though I didn't have positive IgM, let's see. My dad did some research and said since Babesia is a parasite, you either have it or you don't. Just get a test to see if it's in your blood. Is that not what the IgG test was? Or is the PCR peripheral blood smear something different from the IgG blot? and I should book one of these to definitely prove or disprove if I'm dealing with Babesia. All right, let me take that question first. So for a strain of Babesia called Babesia microti, a blood smear may diagnose you or may not. The problem, and that's if you were acutely sick, okay? But when you move into a chronic stage of Babesia, it is not easy to see within the blood usually. And so the best way to diagnose is to see if you have antibodies, which is what probably the IgG test is. So IgG has a variety of ways of measuring if you have a reaction to, or if you have Babesia. One is their test called an immunoblot. That is what you had if you are talking IgMs and IgGs. So IgG, so you may have had Babesia for a while, and that's why you would be making IgGs at this point, okay? Their immunoblot method looks to see if you have antibodies against two particular strains, and in addition, the family of Babesia as well, okay? That's called the species test, all right? All right. Other Babesia testing you can do through IgG. One is a microscope exam called a FISH test, which stands for fluorescent in situ hybridization. And basically they take a fluorescent marker that attaches itself to the germ so you can see it under the microscope better. That test, when it's positive, means you definitely got Babesia in you. But the problem is, just like any blood smear method, you've got to have a lot of it to show up. So it will miss Babesia if you have it often, okay? And then finally, you could do a blood PCR test to see if you can measure the genetic material using the technique called PCR method to measure the genetic material. And if that comes back positive, it definitely means you have it. But again, that doesn't find it all the time either. Of the various methods to see if you have Babesia by blood study, the most sensitive, the one that has the best ability to say, is it in you, is the immunoblot test, okay? The most specific, meaning that when it's positive, it really is positive test, would either be a PCR or the FISH test, all right? Let's see. So I think you've had adequate testing, and if you have enough symptoms, then that means you got it, okay? Let's see. All right, number 2. I finished a consult with an NIH immunopsychiatrist who has advised I do various tests for common variable immunodeficiency. If I do have CVID, would that mean it's possible that my negative Bartonella results are inaccurate because the CVID would have prevented me from having these particular antibodies, even though I did have some for Lyme and Babesia? Yeah, it's possible. It's possible. I will also tell you, when you part of the problem with having these tick-borne infections is that they sometimes do cause immune suppression for that particular infection. So you might have reacted for Lyme and that showed up on your testing, but there might be a degree of immune suppression going on against Bartonella, or you've got the CVID that was interfering with your immune system's ability to make an immune response as well too. Okay. All right. Good luck to you, Kelly. Hello, Colleen. Let's see. For Lyme patients dealing with low energy issues, how do we participate in life yet avoid overdoing it and crashing? How do we know what our limit is when we crash so quickly and each crash is preceded by a different amount of activity? Oh boy, that's tough. I don't have a good answer for you, unfortunately. As many of you know, you have Lyme, you have limits on what you can do. And if you overdo it, you can get into a crash. That's a very common thing that can happen. Generally, what I advise patients is to find your limit. But if it's so variable, I don't have a good rule for you on that one, Colleen. I'm sorry. Good luck to you. Hello, Sarah. Let's see. Hi, Marty. I started treating Bartonella a few months ago back with azithromycin, itraconazole, methylene blue. I got to the point I didn't hurt much anymore, so I recently added in a small dose of rifampin, 75 milligram compounded capsules, 0 milligram. I'm so sick from this small amount. How will I ever get up to 600 milligrams a day? I'm dizzy, short of breath, blurry vision, lethargic. My muscles are all tensed up. Do I keep going or stop? So first of all, I hope you're discussing this with your doctor that's prescribing your medications for you so they can help you make that decision as well too. Part of the problem, so when we, medications that can work, there's a variety of antibiotics, as you know, that can work to kill a Bartonella, and you're on some of them here, the azithromycin, the itraconazole, and the methylene blue, all right? When we look at combinations of antibiotics that seem to be most beneficial at getting at growing and persisting or hibernating Bartonella and also Bartonella biofilms, the laboratory studies tell us that azithromycin and methylene blue, or rifampin, not rifabutin, rifampin and methylene blue are the two strongest combinations, okay? The lab studies did not look at a triple combination like you're on. All right, now, the rifabutin that you're on is in the same family as the rifampin, and even though they didn't test it in these lab studies, it probably has that same benefit at getting rid of Bartonella biofilm, and also getting at growing and persisting forms of Bartonella as well too. What you may have just run into here is that you finally have hit a combination that is extremely strong with all four components, and that is why you're having difficulty handling it. Given that it seems that this rifabutin addition is actually effective at killing, I might consider having you stop it for just a bit to get through this bad phase. And then when you reintroduce it, if you were my patient, I might consider stopping the itraconazole as an anti-Bartonella agent and actually add in the rifampin in place of it. In other words, I might pare back on your germ killers. And the reason I would go with, if you're going to do 3 antibiotics, I would use azithromycin, rifabutin, methylene blue. As I said, azithromycin, methylene blue gets it all two form, the growing, persister, and biofilm communities. And rifabutin, because it's a family member of rifampin, should also, along with methylene blue, get at the same issues. Okay, so that's pretty strong treatment, right? But that might be what I would do. If you're really getting clobbered, I might pull back here for just a little bit. But again, talk to your doctor about that as well too. Okay, all right. Good luck to you, Sarah. Hello, Eric. Hi, Dr. Ross. Is it safe to treat long-term using fluconazole, azithromycin together with methylene blue for Bartonella? Are there any heart issues that can arise from using these two medications together? What are some considerations when using fluconazole, azithromycin together? How strong is this combination in your experience for Bartonella with a treatment failure previously on doxyrifampin for 6 months? Do you need to change up this regimen after a couple of months so Bartonella doesn't get used to the same regimen? Thank you for all you do. Okay, so all right, so you're actually using 3 things. Your fluconazole, azithromycin, methylene blue. All right. The fluconazole is in the same family as the itraconazole that I was just talking about in the last question. That's a really good combination. All right. Now, both fluconazole and azithromycin have a potential of delaying an electrical movement through your heart or causing a conduction problem, okay? And by themselves, for either one of the drugs, it's actually really, really low chance it would happen. But if you put the two together, it's a slightly increased chance of happening. People that are most risk of this electrical conduction problem happening tend to be 50 and older, all right? So in my patients under 50, I have no problem running 6 months or longer using an azithromycin fluconazole combination. If they ever have had a heart problem though, I would put them on both of those and get an EKG to measure this heart electric pattern. It's called a QT interval. I would measure it and see that they're tolerating it well, actually on the fluconazole and azithromycin, okay? And just do it once, all right? And if it looks fine, then you're fine using it long-term, okay? All right? So you can check and see, is it a problem, all right? Now, in terms of how long would I use them together, I've used them for 6 months in general. I usually use the treatments up to about 6 months, but if somebody is still improving on it, I won't change. And I've been known to use the fluconazole azithromycin combination even up to a year, and sometimes combined with that methylene blue at the same time as well too, okay? So no, you don't need to change it every couple months. If it seems to be giving you benefit at about 2 months, by 2 months, if you're on something that, when you treat Bartonella, if the combination of things that you're taking to kill is working, usually by 2 months, you should start seeing some decrease in your Bartonella symptoms. If not, then it's time to change, make a change, whether it's one drug in that combination or the whole combination, but make a change, okay? But if you are 2 months in and things seem to be getting better, you can run that combination as long as you still keep seeing improvements, okay? All right. I think it's a strong combination, to answer your question. I like that combination. All right. Good luck to you, Art. Hello, Dave. Let's see. Hello, Dr. Ross. Thanks for all the knowledge you share with the Lyme patients. You're welcome. I have a question about IgG immunoblot testing. In July of 21, I had my MD perform the IgG immunoblot test on me for Lyme. I was bitten in 2001 and diagnosed with ALS in 2003. The 21 test came back positive, first time ever, for IgG with 4 bands, 23, 39, 41, 93. IgM had 1 band positive. I took your advice and saw the LMD in Zionsville this month. Oh, okay, good. And she ran the same test again. This time the test came back negative for Bartonella or BB, but the IgG did show 1 band positive and 2 indeterminate. The IgM was negative. All other infections were negative as well. What does this test result mean when compared to the 2021 test result? All right, let me answer that question first for you. So the way that I look at my testing when I'm trying to decide if Lyme could be part of the infection or problem, or Bartonella could be part of the infection problem, mainly what I'm looking for is, in the history of your illness, have you ever had a positive test? Right? Ever had a positive test? All right. All right. So by that standard, your 2021 test was positive, and that means you have it. Okay. In my opinion. All right. The thing with IgMs and IgGs is their positivity can come and go depending on what's happening with your immune system. So if your germs are more active, they may suppress the immune system, so the immune system can't make the same reaction. The IgGs may be less positive, like in your second test, okay? So what you're really looking for is, at some point in your illness history, was there a positive test? And I will also tell you, the corollary on that is, there is not a done test, okay? So having your antibodies suddenly go negative does not mean the treatment is done. It just could mean you've got enough germ going on in you that it suppressed your immune system. So there is not a done test. We don't have a test to look at when we're done. So I would look at, even though she repeated it, I would still say, based on that 2021 test, that it's a positive test, and based on having an illness that we see in Lyme, ALS. Although you've had if you were diagnosed with ALS in 2001 or 2003, you've actually had, as you know, that's a long time to be living with ALS. Most people would have probably succumbed to that by now. So that raises the question with me, and I would have to look back at your testing. Just hear me out on this. It raises the question whether ALS was the right diagnosis. But I don't know anything about your testing. Okay, I just said it just raises that question with me. Okay, all right. Question 2. how do I rerun the short message on neuroborreliosis that you ran a month or two ago regarding what is the best protocol for treating it using cryptolepis and one or two other herbs? Oh, so I think you mean what I may have made a statement about that in one of our webinars. So what I can tell you again what it is. I think I'm going to remember the same thing. So if you're looking at 3 herbs that you can use that would probably be effective at going after Bartonella and Borrelia at the same time. And so when somebody has neuroborreliosis, I want to cover for both Bartonella and Borrelia. Okay, both. All right. So and ALS, I want to cover for Bartonella and Borrelia, which is Lyme. All right. So Cryptolepis, Japanese knotweed, and you might throw in cat's claw into that. Now, I may not be remembering the same identical 3 as last time, but I think you'd be okay with this. Okay, so Cryptolepis is an herbal antibiotic that we historically have used to treat Babesia. Studies from a few years ago, or a couple years ago now, showed that it's also quite active against growing and persistent Bartonella and growing and persistent Lyme. Okay, so you get a growing and persistent Lyme and Bartonella with it. Okay, Japanese knotweed also has data from about a couple of years ago now that showed it's active against growing and persister Bartonella and growing and persister Borrelia. Okay. And then if you were to add cat's claw to that, cat's claw is very effective at Bartonella, Borrelia. It only does Borrelia, but it's also very good against persisters. The way that I would do that is persister Borrelia. Okay. All right. So way I would do that, Cryptolepis, I would do it, work up to half a teaspoon 3 times a day. Japanese knotweed, 30 drops twice a day. And the Cryptolep or the cat's claw, I would work up to 30 drops twice a day on that as well too. All right. Okay. Good luck to you, Dave. Hello, Teresa. Let's see. I would like to try methylene blue, but afraid because it sounds dangerous. What can I do on my own without being monitored by a doctor? Is there a blood test that I can do on my own? So I'm not, how can I say this? I don't find methylene blue to be a dangerous drug clinically when I've worked with it before. Okay. So I just want you to know that it does not routinely lead to any problems with your kidneys or liver or even your bone marrow. So when I've had people on methylene blue before, I have not done regular blood monitoring. Okay. All right. Now, there are some things to be aware of from a safety standpoint, and that is that methylene blue, one of its actions is it is a MAO inhibitor, and therefore, and which can result in it leading to slight elevations of a chemical in your brain called serotonin. But if you combine it with an antidepressant medicine that also raises serotonin, you can sometimes get into a serotonergic syndrome where you have too much serotonin. Okay, so those would be medicines like Prozac and that are in the Prozac family. Things like Celexa, which is in the Prozac family, SNRIs, which are another family. Trazodone actually can raise serotonin a little bit too, so I'd be careful with that. But it's not an all or none. What I usually would do with people that were on antidepressant medicines like that is I would still maintain them on the antidepressant medicines as long as they were at about half of what I consider a maximum dose, meaning they weren't at the top dose that we can give it, but at a mid-range to lower. And I never had problem with anyone actually getting serotonergic syndrome on that, okay? The other things that methylene blue can do One of the big things is going to stain your toilet. All right. And I recently learned from one of my patients a good way of cleaning up your toilet, just so you know, and everyone that's using methylene blue, you may or may not be aware of this, but a pumice stone, the kind you use to work on your feet, is actually quite good at getting it off your toilet as well, too. Okay. All right. So anyhow, the other thing I would caution you, if you're doing this on your own, that likely means you're buying it on the internet. And you have to be careful with the internet. That's where the danger comes in here. Keep in mind, methylene blue, although we use it medicinally, is also used to dye clothing. Right? And if you're getting a form that was manufactured mainly as a clothing dye, it may not be safe. So if you're buying on the internet, you need to have them show you their studies where they actually studied the actual substance that's going into your pills to see if there were heavy metals in there, because methylene blue can be loaded with heavy metals unless it's a pharmaceutical grade. Okay. All right. Good luck to you, Teresa. Hello, Nina from Niagara. Hello. It's been a bit of time since you've been here, so I think it's good to have you here, but I hope you're doing okay. But we'll read your question here, Matt. Get some water in here, Nina. All right. Let's see. Hope you are well. If Lyme and Bartonella is reactivated by mRNA vaccines, how long would treatment be using the liposomal essential oils? What would the treatment protocol look like with liposomal herbal oils, oregano, cinnamon, clove? Can I use, you know what? Hold on, I want to go back here. So my last question, you just sparked my memory here, Nina. So for the question on ALS that I just gave a few minutes ago, the three substances would be cryptolepis, Japanese knotweed, and don't use the cat's claw. Go with the liposomal cinnamon clove oregano. Okay, the liposomal cinnamon clove oregano does growing and persister Bartonella and growing and persister Lyme. All right, I apologize for that. I knew. I was trying to remember off the cuff what I said, but it would be cat's claw, or the instead of the cat's claw, use the cinnamon clove oregano. Okay, all right. So Nina, back to your question here. Let's see. BART is reactivated by mRNA vax. How long would treatment be using liposomal essential oils? What would the treatment protocol look like with liposomal herbal oils, oregano, cinnamon, clove? Can I use a blend of individual organic essential oils instead of the commercial blends, and change the essential oils every month so it becomes more effective? As you can see, I'm a little confused. Are essential oils considered liposomal because it's an oil, cinnamon, clove? If not, how does one make liposomal using essential oils? Treating now 4+ months with essential oil, oregano, cinnamon, clove mix with olive oil, feeling 30% better. Hair is growing back, still have persistent brain fog, eating clean, organic, low inflammation foods for 18 months. Thank you for all your help you share with me and others. Any other thoughts are always greatly appreciated. Okay, so Nina, so I know that the Doctor Inspired Formulations product that I carry at my store is called liposomal cinnamon clove oregano essentials. Okay, and they use the word liposomal, but let me tell you what a true liposomal is. Okay, so a liposome is basically a fat bubble, and inside a microscopic fat bubble, and inside is where the essential oils would sit. Okay, that's what a true liposome would look like. And a true liposome would basically increase absorption. That liposome, that fat bubble, attaches itself to the skin lining your intestines and literally is absorbed. Those fats are absorbed directly from it into the cells and then passed into your blood. Okay, all right. A lot of products out there that call themselves liposomal are not true liposomes. What they're doing is they're adding an oil like olive oil, for instance, and they're blending it up. And that extra oil does seem to improve the absorption, but not in an identical way to the way a liposome would. Okay. So you're, using essential oils and adding some olive oil, mixing it all up may mimic what they're doing. I don't know if it's going to mimic it well enough. All right. The other thing, so you could keep using your mix. I don't think you need to rotate 1 month one month the other. I think you could put all of your oils together, blend them up, put a little olive oil in there to increase the absorption. I think that was a reasonable thing to do. As you can hear from our previous conversation, though, there's a couple other herbs that you could consider adding to that. You could consider doing herbal tinctures of cryptolepis, and you could also consider doing herbal tinctures of Japanese knotweed. And the doses I try to work up to for those are half a teaspoon 3 times a day on the crypto, and 30 drops twice a day on the Japanese knotweed. Okay, right. So, but if you're sensitive, you want to add slowly and go slowly on that. How long it's going to take, it's hard to say. The whole vaccine injury thing, we're still not quite sure what happened with that, meaning the actual mechanisms, what led to people getting reactivated infections. And we don't really know for sure how long it takes to get those reactivated infections back under control. I'm glad to hear about 30% better, but you may consider strengthening your treatment by also looking at adding a crypto slowly and adding a Japanese knotweed slowly to that too. Okay. All right. Good luck to you, Nina. And good to see you here too. Hello, Andrew. Andrew says hello, and thank you for doing these sessions. You're welcome, Andrew. Tell you what, everyone, I just need to step away for just a second. I'll be right back in a minute here. All right, sorry about that. Okay, let's see. Next question is from Jim. Hi, Jim. Hi, Dr. Ross. In last week's webinar, you said Methylene Blue and Diflucan would be a good combo for Bartonella treatment. What would started dosages be for a moderately sensitive patient, and what dosages would you want to work up to? Thanks. All right. So for the Diflucan, if you're moderately sensitive, I would probably start at 100 milligrams a day. And as you can, I would work up to 200 milligrams one time a day. Okay. The Methylene Blue, in my practice, I tended to find success with 50 milligrams twice a day. I know that Dr. Tom Moorcroft, who also writes and has some support groups for people living with Lyme, he likes, or Bartonella and Lyme, he tends to find working with a 25 milligrams twice a day on Methylene Blue to be an effective dose. All right. I still think we're all learning how to do it. There's other people in my practice, I had to run up to 100 milligrams twice a day of Methylene Blue. So if you want to go a lower dose, you might start at 25 milligrams a day. And then as you tolerate that, go to 25 milligrams twice a day, and eventually see if you can work that up to 50 milligrams twice a day. Okay? All right. Good luck to you, Jim. Hello, Dwight. I noticed that your herbal frontline suggestion for Lyme and co-infections is now crypto, Japanese knotweed, cinnamon clove, oregano, when it used to be otoba and cat's claw, Psittacuta, hootonia. Is that based on effectiveness from clients or from published studies, herbal costs, for-profit margins? I appreciate your discussing, am I making more money by recommending that, or are other people making more money? No, that's not what the recommendation's about. So there's some new studies that came out, laboratory studies that came out about 2 years ago now, that showed that cryptolepis is quite effective for both Bartonella and for Borrelia, for treating growing and persisters. Okay. In addition, those same studies showed that hootonia, or that Japanese knotweed, is quite effective as well too. Okay. So in my recommendation now on my treatment protocol, my treatment protocol, the Ross Lyme support protocol, basically says if you want to treat all 3 germs at the same time, here is a triple combination that you can use, okay? So the Cryptolepis in there is quite effective against Babesia. There is some data suggesting that Houtenilla may be a weak agent against Babesia, but may help. And the clove oil in the cinnamon clove oregano is probably a weak agent against Babesia as well too. Okay, so you get Babesia with all those. All right. In addition, you also get Bartonella and Borrelia treating persisters and treating growing. My old recommendations for Atobabar cat's claw, Psittacuta Houtenilla were not founded on the idea back then. We didn't know anything about persisters at that time. Okay. Nor did we know Cryptolepis did a great job here too. Okay. Now, in my practice, what I noticed when I started working with crypto, I found it to be a very strong agent for Bartonella and for Borrelia. Okay. I found it to be very good for both of those. Okay. And surprisingly, I'd put it as the strongest for those, actually, to be honest, based on my clinical experience. And it's probably the strongest for Babesia too. So I consider that one of your top herbs. All right. The knotweed and the cinnamon clove oregano, I would say the cinnamon clove oregano probably comes in a little bit below that strength on the crypto, and then knotweed comes in below that. All right. But my recommendations are not for profit. They're basically what I saw works the best. And people have also asked me over time, what would be a way I could go after all 3 of my germs at the same time? And that gives you the way of doing that as well too. Okay. All right. Thanks for the question, Dwayne. Good luck to you. Hello. Let's see. Hi, Nicole. Looks like we got 2 parts to your question. That's the second part. Let me go back. Let me find the first part here. Let's see. I think this may be the first part. Let's see. I've been on Doxy 3 times a day, azithromycin, and atovaquone proquenol for 2 months, and I seem to be experiencing continued and worse weakness. All right. So Doxy, azith, atovaquone proquenol. This is not usually painful, but I don't have much use of my arm, and the other is worse. I don't know if that's expected on treatment. I'm curious what I could add for weakness. Positive Babesia equivocal for Borrelia, Fcellae, and Grunii. And then let's see, I think there's a second part here. I've been on Doxy 3 times a day, azithromycin, atovaquone. Oh, okay. You were starting to write your question there. Okay, got it. All right. So Nicole. So I would probably, to get a very firm answer for you, I would need to ask you a lot of questions, which unfortunately I can't do in this setting. But there's an observation I want to make for it. I want you to know. So weakness sometimes means that you're starting to have neurologic problems, making it so the nerves are not signaling your muscles to work well enough. Okay. All right. So if you're talking about like use of your arms and legs kind of weakness, the one thing that could be going on here is the proquenol in that atovaquone proquenol combination sometimes can have neurologic side effects, as can the atovaquone too. Okay. And so they're very fat soluble. They can sometimes get wrap them into the fat layers around your nerves in your brain, causing those nerves to dysfunction. And therefore you start getting improper signaling of your muscles. And so I would talk to your providers about possibly changing out that component. And if you, and what I would probably consider changing it to is either something called primaquine or something called tefenaquine. Okay. All right. I will show you an article where you can read more about primaquine and tefenaquine here. Keep in mind, if your doctors agree with me and they decide to stop that, because they're fat soluble, they may take about a month or so to completely get out of you and to start seeing some improvement in those side effects. Okay. Let me just do a quick screen share here for you. All right, so take a look at, all right, so in my infection treatment plan section here, look at my Kills Babesia, a brief guide. And then look at, I have two main treatment types. They're both in my tier one, my strongest treatments. One are atopiquone-based treatments. That's what you're on. The second one would be quinoline-based treatments. And in there, you can use either primaquine or actifenacquine. Okay? All right. All right. Good luck to you, Nicole. Hello, Carter. Let's see, anything you recommend for internal staph infections and external HPV warts and ringworm infections? When I got my tick bite, it seems my immune system collapsed and made me susceptible to other things almost instantaneously when otherwise I had perfect skin. Okay. So one thing you might consider, I mean, yes, it means you're having a lot of immune system dysfunction now, secondary having those infections. What I have found when a person is starting to have a lot of problems like that is getting on a good mushroom mix to boost the immune system to fight these infections better is helpful. And so using a mushroom formula, you can find like a 5 mushroom formula that would have things like in it reishi, shiitake, maitake mushrooms, some cordyceps mushrooms in it. I'll show you a product here in a minute. But the mushrooms have a sugar in them that is useful at stimulating the cellular part of your immune system. That's the part of the immune system that fights viral and fungal and even intracellular infections like Lyme. Okay. All right. So I would consider doing something like that. 5 mushroom mix. I would do a pill, maybe 2 or 3, well, 3 times a day is what I would do on that. Okay. I'll show you the product here in a minute. And then in terms of, so HPV, if it is external on you, you're going to need to have those removed, unfortunately. So you're going to need to talk to your doctors about cryotherapy or cauterizing those possibly. And then the ringworm infections, I would look at doing topical antifungals on those, either over the counter, using pharmaceutical chemicals, or you could do mixes that have tea tree oil in them. Sometimes that will help as well too. Okay. All right. So let me show you the one product I was going to talk about here. Okay, so this is my supplement store, and as many of you know, anyone can purchase from here. These are the products I found very useful for working with my own patients when I was in practice. And there are advantages that you would have in purchasing from me. Number one, I curate these, so there's a good chance that they're good products. Number two, I offer them at the lowest prices the manufacturers allow. Number three, I pay for your shipping if it is over $50. The order is over $50. And then also I cover all your taxes for you as well too. All right. And I welcome your business here. So let me show you the product that I was looking at for you. All right. So it's this formula from Mushroom Science. It's called the Immune Builder 5 Mushroom Formula. And in it is, I've got some reishi, shiitake, maitake. I see. It's got corylus and it's got agaricus in it as well too. Okay, but those would all be useful mushrooms to help boost your immune system. Okay. All right. Good luck to you, Carter. Hello, Astrid. Hold on here just a minute. Oh. Let's see. Hi, Astrid. I'm very confused about my test results. I am positive for all 5 mycotoxins on real-time lab urine test. I tested my house, work, and car. Only 2 of the places grew mold, so I sent them to the microbalance lab to be analyzed. The raw count is 1011, which is good normal. Not sure what to do next. I'm not getting better from Lyme and co-infections. I've taken antibiotics, herbals, and I've even started ivermectin for parasites. Could it be yeast in the gut? Symptoms are extreme anxiety, neck, shoulder aches being worse. Thank you. So, if you're not getting better and you have tick-borne infections, there are 2 things to look at. Number 1 is, do you have intestinal yeast overgrowth? And number 2 is, do you have mold toxicity? So your test shows you that you have toxins in you. Where you acquired them could be not in the house you currently live in. So the thing about mold toxins is once you breathe them in, they get trapped in you, they stay in you. So you could have acquired these from a childhood home. You could have acquired these from other places you've been. They may not necessarily show up in your house or your car. Okay. So I definitely would. So both intestinal yeast overgrowth and mold toxicity trigger your immune system to overproduce cytokines. And as you know from our discussion earlier tonight, it's the cytokines that give you most of the symptoms that are related to these illnesses. So first of all, I would work with your provider to find on using binders to get those toxins out. And then in terms of do you have too many yeast, here's some questions to consider. All right. So having been on antibiotics for a while, even if your providers were doing some things to prevent yeast from moving into your intestines, it's still possible you have too many yeast growing in there, okay? So regarding that, some things to look at as to whether you might have too many yeast. Number 1, do you have increased sugar cravings? Number 2, do you note that if you ever have something with sugar in it that you get worse pretty quickly afterwards? In other words, when you feed your yeast, you suffer for it right away. Do you have a lot of intestinal gasiness and bloating? One of the things that intestinal yeast overgrowth can lead to too is it can cause skin issues, including developing pimples and acne, sometimes having worsening of eczema, sometimes having worsening of your dandruff. That can be a result of toxins from yeast getting into the blood system, interacting with your skin. Okay, so and then finally, the other thing to consider, 2 other things to consider that might indicate too many yeast is a frequent vaginal itching and discharge, and then sometimes having difficulty swallowing. Sometimes if you get yeast up here in your food pipe, as you swallow, it can feel like things get caught in your food pipe, okay? So if you said yes to a number of those things, then you might want to consider treating yeast as well too, okay? All right. So let me just do a quick screen share here for you. I'll show you 2 articles to look at, Astrid. Actually, 3 articles to look at. All right. So in terms of figuring out if you have too many yeast, take a look at this article called A Silent Problem Is It Yeast? Okay. And then what to do about too many yeast, take a look at my article called Kills and Prevents Yeast, a brief guide. All right. All right. And then in terms of mold toxicity, take a look at my detoxification chapter and then read this article, Mold and Lyme Toxin Illness, where I'll discuss various binders and how you would go about treating that as well too. Okay. All right, let's see here. Hello, Nicole. Let's see. Oops. Oh, that was from earlier. We got that one already. Hello, Andrew. Let's see. Please comment on your most recommended regimen for treatment of. Try that again. Please comment on your most recommended regimen for the treatment of neurosymptoms such as chronic depression, sleep disorders, forgetfulness, and lethargy. Thank you. Huh. So, first of all, you've got to get at, you need to look and see what the underlying chronic infections or mold toxicity is that you have and treat those. Okay, so, be on binders if you have mold toxicity, be on herbal or prescription antibiotics if you have the various infections. Okay, so that's number one. Number two, if you have sleep disturbances, you still need to work to get those under control. And that may mean you need to use herbal medications or prescription medications to help control those, because getting sleep will help lift your depression to a degree, will help your thinking and your energy do better, will help your immune system work better, and can help neurologic symptoms as well too. All right. So in terms of prescriptions, non-addicting prescription medicine, you might consider is something called trazodone. That's an option. Herbally, you could look at using herbal sleep combinations. They usually have a variety of things in them. They'll have valerian in them. Sometimes they'll have 5-HTP in them. Sometimes they'll have magnesium in them. Sometimes they'll have passion flower in them, but various combination sleep or herbal products. Okay. And sometimes you have to layer together prescription and herbal approach. All right. Number two, I would work on getting your cytokines, or number three, so deal with your infections, your problem, get sleep. Then I would also be on something to lower cytokines. And in this situation, I would do two things. I would be on curcumin. Curcumin lowers inflammation cytokines, which may help with the chronic depression, may help with your neuro symptoms, may help with the forgetfulness and the lethargy. And I would do 500 milligrams 3 times a day. In addition, I would work to lower cytokines and improve detoxification by being on liposomal glutathione. And I would, so glutathione is the master detox chemical, but it's also a very powerful antioxidant that tells your white blood cells to stop making or blocks the message going to white blood cells, telling them to make cytokines. On the other hand, curcumin gets inside the white blood cells and tells them to knock off the production. Okay. But you could do like a liposomal glutathione, the Trifortify mix by Research Nutritionals, a teaspoon once a day. Okay. And then final two other things that you might consider doing. One is to take a mitochondria support substance that will help your energy factories heal and work better, mitochondria or cell energy factories. That product is something called ATP 360. I would do that 3 pills 1 time a day. And then finally, you might even consider adding a peptide into the mix here, which would be BPC 157. Peptides are naturally made in our bodies, and you can get them in supplemental form as well too. This peptide called BPC 157 is a useful mitochondria support. It also is useful at helping your immune system balance, and it is also useful at doing tissue repair, like dysfunctional brain tissue, for instance, too. And that would be BPC 157. I would do 1 pill twice a day. So that's what I would suggest. But clearly, you should talk it over with your physician and see what they recommend. But again, go after the cause, take something to get sleep, lower your cytokines, and then consider ATP 360 to support your mitochondria, rebuild the covering on the mitochondria. Those are your cell energy factories. If your cell energy factories work better, that means the cells that influence depression and your thinking and your low energy levels too. Okay. And then finally, the BPC 157. Okay. All right. Good luck to you, Andrew. So Andrew, if you're wanting to see where I pulled all those ideas from, let me see here. All right, so take a look at my Ross protocol. And basically, I kind of just went through parts of this. I looked at sleep with you. I looked at getting cytokines under control. I looked at a little bit of detoxification there. I did mitochondria section is not in here, and the BPC 157 section is not in here, but that gives you some of the general framework at least, okay? Good luck to you. Hello, Sylvia. Hello from London. Hello, Sylvia. It's a little bit late there for you, for sure. Let's see. I tested positive for Lyme, Bartonella, Babesia with dual DUR method. At the same time, also tested gut dysbiosis, including overgrowth of Klebsiella strep, H. pylori. I have chronic cervical lymphadenopathy and raising EBV, CMV, IgG levels, which are considered a reactivation, I believe. I'm currently 1 month into Japanese knotweed crypto plus after a month of Chinese skullcap and a month of azithromycin doxy, which helped a lot with arthritic pain, but the fatigue and fever got worse after I stopped. Question 1. My naturopath has prescribed serrapeptase as a biofilm disruptor. I see in your protocol you suggest the cinnamon clove and oregano combination. What do you think of serrapeptase? So let me see. So I'm just trying to look back and see what you're currently on. I'm currently 1 month into Japanese knotweed and crypto. Okay, so you're on knotweed and crypto. All right. So in terms of serrapeptase, it can be a useful biofilm disruptor, as can the essential oils and the cinnamon clove oregano combination. In addition, though, the cinnamon clove oregano combination, in addition to breaking up biofilms, also is antibiotic. So it can kill your infections. It may even help with some of the viruses there as well, too. And in addition, it goes after the hibernating form, the growing and hibernating form. So you get more out of a cinnamon clove oregano than you do the serrapeptase, okay? All right. So to answer your question, do they both work? Yes, but differently. All right. Let's see. Question 2. Medical doctors here have categorically said that I do not have Lyme and are offering to do a fine needle biopsy on the lamps, and the ultrasound technician said, you are really a mystery. I'm still considering whether I should do the biopsy or wait. My naturopath has invited me to the Armin Labs ELISpot for CMV, ENV, and immune profile. Will these tests get my answer? So the one thing I would say, persistent lymphadenopathy often can be part of Bartonella. All right. Will they see it on a biopsy? Maybe not. But when you have persistent lymphadenopathy, there's also the risk of cancer. And I suspect the reason they're wanting to biopsy is for that reason. So I probably would say, yes, get that done. But I would let you know another alternative is treat your Bartonella for a month or two. But if in a month or two, if the lymph nodes are not getting smaller, then I definitely would proceed with getting the biopsy done as well too. Okay. All right. And in terms of the cytomegalovirus and Epstein-Barr virus, even if they have reactivated, the way to get them under control is to get your tick-borne infections under control. Your immune system would have allowed them to reactivate, and your immune system will get more under control and will help get those under control as you get your tick-borne infections under control. Okay? All right. Good luck to you, Sylvia. Hello, Trish. Let's see, what are constant foot vibrations? So they're an irritated nervous system, and often I will see that in Bartonella. Sometimes it can be part of Borrelia as well, too. Okay. Thanks for the question. Hello, Eve. Let's see, what might be the best product, natural, not prescription, for brain issues such as motion sensitivity, mild brain fog, mild light sensitivity, diagnosed with mold toxicity in 2013. After various treatments for mold toxicity, MCAS, leaky gut, and food histamine intolerance, I'm about 85 to 90% improved. However, still get triggered with brain issues, especially when trying to drive on the highway. Overstimulation from all activity via highway, where it gets very busy, sunlight flashing through the trees while driving. Become hypersensitive. Won't do long distance and or highway driving alone because of the discomfort. Thank you for all you do. You are incredible, truly. Thank you. My practitioner has me on Mycobine. So about 2 months ago, I also do sauna 1 to 2 times as an Epsom salt bath 1 time a week. Been doing that for a few years. What might be the reason for the symptoms? Okay, so when you have mold toxicity and even infections, but in your case, the mold toxicity, the mold toxins can be directly harmful and toxic to the coverings on your cell mitochondria. So your mitochondria are the energy factories found in every one of your cells, and the covering of a mitochondria is made up of a double layer of fat or a phospholipid membrane. All right. The mold toxins are directly toxic to that. In addition, the mold toxins can injure the phospholipid membrane layer that makes up the covering of your nerve cells and all of our cells, all right? So the one thing, unless you've done this already, that you might look at doing is mitochondria and phospholipid repair, okay? So the way to do that is you want to repair the phospholipids of your nerves and the phospholipid of the nerve cell covering, as well as the phospholipid membrane covering of your mitochondria. And what I like to do for that is the product called ATP 360 by Research Nutritionals. It's their proprietary mix of phospholipids. You take 3 pills 1 time a day. There's also some micronutrients in it that help your energy factories work better. Okay, so number 1, I would do that. Secondly, when your mitochondria are injured, they also need to have boosted antioxidant levels as well, too, to help repair. And what is useful for that is glutathione. And so I would use liposomal glutathione. I like the Trifortify product for that. And I would do 1 teaspoon 1 time a day on that as well. Okay. All right. So those are the two. And I would look at doing that see if by 2 to 3 months you're feeling better. If you aren't, then I would consider doing that for a total of 6 months, actually. Okay. All right. Let me show you where you can find those products I was just recommending for you. All right, so this is the ATP 360 that I was talking about, 3 pills 1 time a day. And then in terms of the Trifortify product, there's a variety of ways that it comes, but this is where you can find all those Trifortify products, okay? All right. That's the glutathione product I was just telling about. Good luck to you, Eve. Hi, Nicole. Let's see. Hi, Dr. Ross. Do you ever see weakness in the form of limited use of an arm as a symptom of Lyme or just the result of the medication? It could be either one, actually. So it depends. Some of the medications can cause neurologic dysfunction, and Lyme can as well, too. Also, if it's mainly one-sided, I would want to make sure what's going on in your neck. Do you have anything pressing on the nerves out of the neck? So like an MRI, you might want to look at that as well, too. Okay? All right. Good luck, Nicole. All right, let's see. Hello, T. Do you feel Methylene Blue and Baluchi Byrite formulas are enough to treat Lyme, Babesia, and Bartonella? So I do think Methylene Blue is useful against Bartonella and Borrelia. both growing and persister forms. It is not a useful agent for Babesia, okay? And then Beluki, which is lumbar kinase, is useful at breaking up biofilms. It's also useful at treating what are known as fibrin nest, where germs and the blood-clotting protein fibrin mix together. That can occur in Babesia and can occur in Bartonella. So that's useful. In terms of Byron Wright formulas, I just don't find them that effective. I know a number of my colleagues use them, but my own experience was that it was not that effective. And if you're looking for herbal options, earlier tonight I discussed to treat all of these, you would look at using Cryptolepis along with Japanese knotweed, along with liposomal cinnamon, clove, oregano. Okay? All right. Good luck to you. All right, everyone. That's it for me for tonight. I know I'm stopping a little bit early, but I've got a splitting headache going on right now, and I think I'm just going to go ahead and stop here. It's been good to be with all of you, and I look forward to doing this each week when I do it. I will be off next week, having said that. Tomorrow, but I will be back 2 weeks from now. So tomorrow morning, you'll get an email from me, which will have a summary of what we talked about and a link to the video recording. You'll also have an opportunity to sign up for next week's webinar at that time as well, too. And as I mentioned earlier tonight, a request, send it to anyone that might get benefit. I'm trying to help as many people as possible. Okay. So good to be with you here. Good night. Take care, everyone.